Well, a lot of the female patients I see with voiding dysfunction, the goal is to really, number one, ascertain as to what the cause of their voiding dysfunction is. And that can revolve around stress incontinence, where they'll leak with heavy lifting, coughing, sneezing, running, those kind of symptoms. Or it'll be something more on the other spectrum, which is urgency frequency. They'll have many accidents at night. They'll get the urge to urinate, can't make it to the bathroom quick enough before they have an accident. Evaluation in the office for patients with voiding dysfunction often centers around the functionality of the bladder. We'll do a thorough pelvic exam. We'll do a full history and physical, make sure they've done everything conservatively to manage their voiding dysfunction first. And then oftentimes we'll perform a cystoscopy, which is a look inside the bladder. Then we go to a treatment. Oftentimes we'll start conservatively with medications or with physical therapy, do things like decreasing your fluid intake, making sure the patient understands that a lot of it is on them upon trying to improve their symptoms with a change in their overall lifestyle. And so that's always the first priority. Then if it requires something a little bit more involved, oftentimes we'll end up doing a procedure of some sort, like a urethral sling or a possible reconstructive case for prolapse. The key is to do a thorough physical exam, making sure you can try to really demonstrate exactly what area of the vagina or what area is prolapsing, be it the bladder, be it the rectum, be it the uterus. If they've already had a hysterectomy, it's where the uterus used to be will prolapse. So after an adequate thorough exam, and you can tell which area is dropping, the options of surgical intervention are based upon your exam, and they can be done vaginally and then also can done laparoscopically, which is where we oftentimes incorporate the use of the robot, and the patients do quite well with that procedure. Usually go home the next day.